Everybody. Thank you for joining us for this session on diabetes management and continuous glucose monitoring, which is a fabulous service we have at our clinic. And I'm excited to hear Dr. Dumont, who's our expert on it, tell us all about it. The session is being recorded, so please leave your microphone muted. If you do have a question or comment, feel free to use the chat feature, or you can unmute your microphone, and we are more than open to your participation. So the webinar schedule is posted online at our website under the Health Education tab. Our next webinar is not yet scheduled. We are doing them about once a month, and I am taking requests. So if there's any topics that you would find interesting, please send me an email and we can make it happen. We've had a lot of topics so far, and we've covered everything from diet to sleep to COVID. And so if you have suggestions, let me know, and I'll be happy to find a speaker and we can put a webinar together. If you'd like to listen to this webinar again, we post them on that same page on the website under Health Education. I'll be posting this one by next week, and all the previous webinars are in the archive as well. So we do want your feedback. So after the session, I will send a brief survey, and if you have any comments or feedback for Dr. Dumont or us in terms of these webinars, please let us know. It really helps us make these more tailored to what you all are looking for, and you're our patients, and we'd love to make sure that these webinars are meeting some of your education needs. A couple clinic announcements. For those of you who have not come back to our clinic yet, we want to let you know that we're doing our best to keep it safe and clean as possible. These are some of the steps we are taking, and we are safer than a grocery store, so please don't delay your care and come into the clinic if you do need a visit. We still have televisits available, so you can connect with us that way too. So when scheduling, whoever is scheduling you can help you decide if coming into the clinic or doing it virtually is going to be better. Another way to engage with us right now is through our patient portal. You can request appointments, message your provider. There's a lot of really fantastic features on our patient portal, and you can even access your visit notes and labs. So go ahead and check it out. There's two ways to get on the portal. One is by using the Helo app, and the other is going on to the website. There is a link from our website to both of those, so be sure to check it out. If you do have questions or need help getting set up, let us know, and someone usually someone at the front desk will be happy to make sure you have the right password and get you that access. And lastly, we really appreciate your business as patients. We don't really call it business because you are our family, and we really care about you and your health, but we are still a small business. So if you are happy with your experience, please share a review online and let others know so we can keep our doors open and welcome new patients. And if you do have any concerns or feedback for us that we can do to make your experience better, also let us know. We'd be happy to make sure that we are taking care of you right. I'm going to turn it over to Dr. Dumont for our session today. Thank you all again for being here. And Dr. Dumont is a clinical pharmacist at Westminster Medical Clinic and also a certified health coach. So she lands in these two really great worlds of helping us figure out how to manage diabetes from both angles. So thank you for joining us, and I will turn it over.
Thanks, Stacy. And yes, thank you all for being here this evening. Feel free as I'm talking to, if you have any questions, put a note over in that group chat or unmute yourself and ask. I'm happy to answer in real time. Don't feel like you have to hold it in and potentially forget as we go through. So here we go. What we're going to talk about, Stacy, do you mind going to the next slide? Thanks. So first, I'm going to go through what continuous glucose monitoring is, how it works. There's a couple different types. There's professional and personal, and I'll talk about the differences, why someone might benefit from wearing one, and what you might need to know about them. Then I'll touch on lifestyle and the effects that your lifestyle can have on managing your blood sugars, and talking about nutrition, physical activity, and then health coaching at Westminster Medical Clinic. Like Stacy mentioned, I'm a certified health coach, and Stacy is a super experienced certified health coach as well. So you have lots of options at Westminster Medical Clinic. So you've probably seen commercials on TV talking about CGMs, and in those commercials, people are outside smiling and exercising. And if you have a CGM, your life's going to be perfect and great, just like these people on this picture. But what really is a CGM? So what it is, CGM stands for continuous glucose monitoring. Next slide, please. So continuous meaning all the time, 24 hours a day, 7 days a week. Glucose means sugar, and monitor is just watching. So a continuous glucose monitor is watching your sugar all the time, day and night. Next slide, please. All right. So what does it actually do? What it does is there's a sensor that's inserted under your skin, and that measures the sugar in your interstitial fluid. Interstitial fluid is just the liquid that's between your cells, that's underneath your skin. The sugar goes from your blood vessels into that space underneath your skin, and that little sensor that is inserted underneath your skin continuously measures that sugar level. When we get this constant information of the sugar levels, you can better see how different types of food affect your blood sugar and how physical activity also changes your blood sugar. For those of you who might have diabetes type 1 or type 2, you probably know that there's other factors that affect your sugar levels besides just diet and exercise, things like stress and illness. If you have information from a continuous glucose monitor, you can track how those kinds of things affect your sugar levels as well. So ultimately, when we get information from a continuous glucose monitor, it can help you and your provider make better decisions about how to balance your food and physical activity and medicines. So some of these continuous glucose monitors have special features. They can send you alerts if your sugar looks like it's going to go really high or really low, which can help prevent those events from happening. They're always on, and they're always measuring your sugar levels no matter what you're doing, whether you're exercising, sleeping, showering, everything. And this can be useful to help prevent dangerous situations. So like I mentioned before, there's two different main types of continuous glucose monitors. There are professional monitors like we have at Westminster Medical Clinic. And when I say they're blinded, that means that while you're wearing that monitor, you don't have access to the information in real time. There's a sensor that just stores the information for the 7 days that you're wearing that monitor. Then you bring it back to the clinic. We upload the information into our computer software, and it generates a report, which I'll show you an example of later on in this presentation. The second kind is the personal continuous glucose monitor, and those are the kinds that you see commercials for on TV. Usually those do transmit the information to a reader or to an app on your phone. So you can see what your sugar level is in real time anytime you want to look at that reader or at that app. It also shows you what it's been doing in the past, and some even can show you trend lines, what it's likely to do in the immediate future. That sounds great, right? But there are some special requirements. With most continuous glucose monitors, you still need to test your blood sugar by finger stick with the old-fashioned glucometer, usually twice a day, if not more. That's to help the continuous glucometer maintain accuracy and give you levels that are true. The sensors that are inserted under your skin also need to be replaced regularly. That can be anywhere from 7 to 14 days in general. It depends on what type of continuous glucose monitor you're wearing. All right, so we've talked about what a continuous glucose monitor is. Let's talk about how it works. Next slide, please. Stacy, can you, thanks. So this is a picture of the sensor that would be inserted under your skin. That little wire that looks like it's poking the woman's finger is the filament that goes underneath your skin. These are worn usually either on your abdomen or on the back of your arm. That little sensor is about the size of a fishing line, if not a little bit thinner. And the length is about the size of a pen needle that you might use for your insulin. So it's 1/4 of an inch to 3/8 of an inch. It's really flexible. And that's the little piece that's measuring your sugar levels between your cells. Next slide, please. So once this sensor is placed in your body, whether it's your stomach or your arm, all of our stomachs look like that, right? They're all nice and flat. Once that sensor is placed on your stomach, then a recorder is attached to the sensor. The recorder in this picture is that white disc that looks kind of like the top of a mushroom. And the sensor is that clear base that's at the bottom of that. It's the stump of the mushroom. The white mesh around that is the adhesive or the tape that sticks that whole apparatus to your skin. And that tape is really strong. When you're wearing that sensor and the recorder, you can shower, exercise, sleep. That's pretty uncommon to have it become dislodged. And depending on the type of continuous glucose monitor you have, that recorder either just stores all the information or transmits it, like I said, in real time to your reader or to the app on your phone. Next slide. This is a picture of one that goes on the back of your arm. Even though it looks a little bit different than that first picture, it's the same idea. There's a sensor underneath that white plastic recorder that you can see, and the outside gray circle is the adhesive that sticks it to your arm. Next slide. So I mentioned that there is a reader for personal continuous glucose monitors, and this is an example of what the reader might look like. If you use a continuous glucose monitor that uses an app on your phone, the display is often similar, or the idea is the same. So I want to orient you for a second to what this display shows. If you see the very bottom of that screen, it goes from 2 p.m. to 10 p.m. So that's showing you 8 hours worth of sugar levels for the person who's wearing this monitor. The axis on the left-hand side, 50, 150, 250, 350, those are the sugar levels. So it goes down from 50 to 350. The blue bar that travels across that graph is the target region for this patient who's wearing this monitor. So it looks like that patient's target is somewhere between 70 and 150-ish. That target range can be tailored to whatever your goals are that are set up by you and your provider. And then that black line that's squiggling across that graph is the actual sugar levels of this patient who was wearing this monitor. So you can see that on this patient, they were on the low side somewhere around 3 p.m. And then probably after dinner, after 6, they started going a little high. But for the most part, that black line stays in goal. So this patient looks like they're pretty well controlled. That big 112 at the top is what the sugar level is right now while we're looking at that reader. And the arrow to the left, to the right of that 112 shows that according to this sensor and this reader, it predicts that the sugar is on its way up. So if you were looking at this, you could say, oh, my sugar is going up, but that makes sense because I just had a snack, or maybe I need to go exercise, or I forgot my insulin, or that can help guide what your choices are going further. What questions do you have so far? Okay, next slide. So just to recap, the way these continuous glucose monitors work, this is a cross section. So at the top, that white UFO is the glucose monitor. Then the little filament goes under your skin and measures the sugar in your interstitial fluid, which is the fluid between your cells. All right. We've talked about a continuous glucose monitor and how it works. So what kinds of people should use a continuous glucose monitor? Talk about that. Next slide, please. All right, so people who might benefit from wearing a continuous glucose monitor. These were first developed with people who have type 1 diabetes in mind, because people who have type 1 diabetes are on complex insulin regimens, and it can be quite challenging to get those insulin regimens dialed in to achieve good sugar control without causing episodes of low blood sugars. But type 1 diabetics are not the only people who can benefit. There's plenty of people who have type 2 diabetes who can also benefit from using a continuous glucose monitor. So if you are a person who has type 2 diabetes and you use insulin, that could be a continuous glucose monitor can help you and your provider adjust that insulin dose to keep you safe and also keep your sugar levels in good control. Some people who have diabetes can't feel it when their blood sugars go low. So we call this hypoglycemic unawareness. And if you are a person who can't tell if your sugar is going low, that can be a pretty dangerous situation, because if your sugar goes too low, that can lead to coma. It can also lead to death. So if somebody does not feel when their sugars are going low, wearing a continuous glucose monitor can definitely create a safer environment for using insulin or other medications to sound out warning if the sugar levels are starting to go low. People who have extreme highs or extreme lows in blood sugars can also benefit from continuous glucose monitors, and anyone who's interested in how their lifestyle affects their blood sugar. I mentioned before that we have professional continuous glucose monitors and personal, and that the professional that we have at Westminster Medical Clinic is a 7-day CGM. So as you might guess, CGMs can be used just for a short period of time or for months and months. So depending on your needs or your desires, you can tailor the information to what makes the most sense for you. Next slide, please. Okay, so a continuous glucose monitor can help manage your sugar levels because it can identify trends. So patterns of when you're going high or when you're going low. It shows information that an A1C and finger sticks might not, and I'll get into that in the next couple of slides. And like I mentioned, it can show if you're having hypoglycemic episodes, those episodes where your sugar is going low. Sometimes even people who can feel when their sugars are going low might have low episodes in the middle of the night when you're sleeping, and you might not be aware of it. So if you do a trial of the CGM, that can uncover those episodes and help us get you safer. It can also help choose the best way to target your sugar levels, whether it be diet, exercise, or medicine, or a combination of all three. And we know that over time, good management of sugar levels helps people who have diabetes stay healthy and prevent complications of the disease. Next slide. So there are some limits about wearing a continuous glucose monitor. They can be expensive depending on your insurance and depending on your medications. Coverage, sometimes insurance will only cover continuous glucose monitors for people who have type 2 diabetes if they're on a multi-insulin regimen, so mealtime and basal insulin, depending on the insurance. If you are able to afford one, you can live your normal life. If you exercise, you can continue exercising. I think I mentioned that many of them do still ask you to check your sugar by finger stick, so it's not a get out of jail free card, getting away from that glucometer. If you use insulin and you're wearing a monitor on your belly, you need to inject the insulin at least 3 inches away from the meter. If you have skin irritation from the adhesive from that CGM, it's easy to remove. And then this is something I tell patients who wear our professional CGM in the clinic. We can remove it, get the information for however many days you were able to tolerate it, and then try a different adhesive in the future if necessary. One thing to know about the professional CGM is that even if your insurance won't cover a personal CGM, the professional kind that we have at Westminster Medical Clinic is billed through insurance just like a doctor's visit. So if you have a $20 copay to come in and see Dr. Hammond, you would pay a $20 copay to come in and have the CGM placed, and then another $20 copay to come in and get the report and get your analysis about what we need to do going forward after you get that report. Questions so far?
Cindy, a couple of questions. One for like the personal, when you're saying it could be expensive.
Yeah.
Define expensive.
I have seen it be as high as like a $600 startup cost because you need to have a sensor and a reader. Once you do that startup cost, then sometimes it's upward. It might be $100 to $200 a month. Sometimes it's as little, but I think the least expensive I've seen it dispensed in a pharmacy is $35 a month for those sensors that you need to replace regularly. So if it's something that you are interested in, I'd be happy to help research that for you outside of this presentation, but I could contact insurance and see if it would be covered.
Yeah, it just seems to me that the personal one is more, if you're trying to establish real time, okay, I ate this banana, what did it do to me? You know, these type of things, instead of waiting a week to try to remember, okay, did I eat a banana on that date?
Well, one thing I should have mentioned with the professional CGM that we do at Westminster Medical Clinic that is billed through your regular medical insurance, I recommend anyone who uses that to keep a food log and an exercise log, because I know that it is hard to remember, oh, look, last Tuesday my sugar was 300. What did I eat? I don't remember. But if you keep a food log, then you can kind of go back and do that uncovering. But yes, I agree. To get the real life in real time information can be a lot more effective. All right. So this is an example of what a report might look like if you do the professional CGM at Westminster Medical Clinic. This is similar to what we saw on that recorder earlier in the presentation, but this is the first page of a 8 or 9 page report that you would get. This summarizes all of your sugar for 7 days. So just to orient you, across the top of the graph, it goes from midnight to midnight. So it's 24 hours on this graph. Along the left-hand axis is the sugar level. So this goes from 40 to 400. And then that green bar is the target range. So this target looks like it's about between 70 and 150. And you can see that this particular, and each of these colored lines represents 1 day. The black dotted line is the average. So you can see that this patient in the middle of the night was great. And then during the day, the sugar level goes higher. So you can see that if we were going to talk about medications or lifestyle, we might talk about a diabetic friendly diet. We might talk about some kinds of medications that target food intake rather than your overall sugar level, because this person is well controlled in the middle of the night. So if this person were testing their blood sugar at 6:30 in the morning every day, and that was the only time they tested their blood sugar, we'd say, you're looking great. And then they'd get their A1C back and they'd say, how come my A1C is 8%? And this will explain why where that difference is. Next slide. All right, so here's an example of somebody who goes low in the middle of the night. You can see all those lines really early in the morning, starting about 3 a.m. to 9 a.m., going below the green bar. So this person, again, if they tested their sugar every day, say at 10, it would probably look okay. But in the nighttime, they're going really high. In the early morning hours, they're going really low. So they're getting these big swings. And when we got this information, then we are able to maybe back off of the basal insulin and start targeting those mealtime sugars. So this is another patient who, depending on when they test their blood sugar by finger stick, they might say, wow, my sugars are always high because I test right at 6 p.m. So I'm going to keep increasing the insulin, and we're going to make them keep going lower and cause a dangerous situation. So the CGM information helps us make safer decisions in addressing that. Next slide. I'm running out of time here. So this is another one that's just, there's no big highs, no big lows. It's just overall kind of a little bit too high. So that's a different picture that the CGM tells us. All of these patients had a similar A1C. So I just wanted to highlight that there's your A1C, which is an average of your last 3 months sugars, tells a different picture than what your day-to-day sugar levels are. Next slide, please. So real quick, holy cow, lifestyle and diabetes. Next slide. We know that nutrition is key in helping manage blood sugars. So there's not a one-size-fits-all approach. The best advice I can give as a general rule is to focus on eating a variety of whole, nutrient-dense foods, avoiding those processed foods and sugary foods, maintaining a healthy weight. And here's my plug for health coaching with Stacy or myself. It can help you form realistic goals and achieve sustainable habits. So not just losing weight in the short term, but figuring out how to eat and enjoy your food and prevent those big swings in sugars high to low. Next slide. Physical activity. The American Diabetes Association recommends 150 minutes per week of moderate to vigorous intensity exercise. So that's on average 5 days a week of 30 minutes of exercise. I put that little asterisk there because it's important to check with your provider to see if that is appropriate for you, depending on your other health conditions. It's important if you are healthy and given the okay to exercise, go no more than 2 days in a row without activity, decrease your sedentary time, get out of your chair every 30 minutes. That's really important now that lots of us are working from home, sitting in our home offices. And another plug for health coaching. If you talk to a health coach, we can help you figure out some sustainable goals. And even though 150 minutes a week might seem unrealistic at the moment, gradually work yourself up to that. Next slide. Health coaching at Westminster Medical Clinic. We've got 2 different options. We've got the 12-week or 6-month options with Stacy. They include that whole list of things all wrapped up into one cost. You get to see her every other week and get check-ins and a newsletter, or you can do 45-minute single sessions that are billed through your insurance. If you are interested, talk to your provider, call us, or send us a portal message. In the next slide, I'm going to show you where to find this information on our website. If you go to westminstermedicalclinic.com, go to services at the top of the bar, you'll see that drop-down menu, hit health coaching, and you'll see a whole lovely page that details all of the options that you can have here at Westminster Medical Clinic. I apologize for going over. What questions do you have? Well, I thank you all for being here this evening. There's a lot more involved in lifestyle management and medication management, but that's the time we have. If you have further questions, feel free to send us an email, call us, schedule an appointment. We're here for you. Thanks.
Thank you so much, Dr. Dumont, for being with us today, and thank you all for attending. If you, like Dr. Dumont said, if you do have questions, feel free to email me. I'm happy to pass them along to her, or you can also reach her directly on the portal. Thank you all, and please keep an eye on our website for our next webinar. And like I said at the beginning, if you have feedback on what kind of webinar you would like to see or what topic you'd like us to bring an expert and touch on, please send me that message and we'll be sure to put that on our calendar. Thank you all so much and have a great rest of your Wednesday evening.